Hi, Mrs. Andrews. My name is Kira, and I'm a nursing student here at the University of St. Francis. I'm just going to be doing your newborn's assessment today, and I just have a couple questions for you before we get started. So how often is she urinating? Okay, and how often is she having a bowel movement? And how often is she eating with those bowel movements? Okay, I'm going to go ahead and wash my hands, and then we can get started. First thing that I'm going to do is I'm just going to check her name band to make sure that this is your baby, which it is. So I'll just wrap her back up here while I'm doing the other stuff to keep her warm. First thing I'm going to do is to take off her hat so I can take a look at her head. I can see her anterior fontanelles. There's no scratching, bruising, or bleeding. There are no bumps. And then I'm just going to take a look at her ears. They're midline and symmetrical with good recoil. It's not slow. If it were slow, it would indicate prematurity. So her recoil suggests that she is a term baby. Looking at her eyes, there's no redness, drainage, no yellowing of the eyes, which would be indicative of jaundice. Looking at her nose, there's no nasal flaring, no distress with breathing, and her nares are clear. And then I'm just going to put some gloves on, and what I'm going to be assessing here is her mouth. I'll be looking for a rooting reflex, which I'm basically just going to gently touch the side of her face, and if she turns her head towards the side of the face that I'm touching, that's what we're looking for, which she did. Good job. And then I'm going to assess her sucking reflex here with my gloved finger, and that is also intact, and I'll also be feeling for the hard palate in here, making sure there is no openings, which would indicate there's a cleft palate, which there's not. The hard palate is intact. And then I'm going to take her temperature here, and it should be 97.9 to 99, which it is. So then I'm going to take a look at her neck and chest and her clavicles here, which they are midline and even with each other. There is no masses or bruising on her neck or her chest. Her abdomen is soft and round. And I'm just going to take a listen to her heart now. It should be between 120, and 160 beats per minute. And then in this spot here, I am going to listen for a full minute. Okay, and I'm just going to be listening to her breath sounds. And her respiratory rate should be between 30 and 60 breaths per minute. And that sounds good. And then I'm going to take a look at her hands here. And I'm just going to be looking at the creases inside of her palms to see that if there are multiple, which there are, and she has all 10 fingers. And if she were to have a single crease inside her palm, that would be indicative of Down syndrome, which there is not. There's multiple, so that's what we're looking for. Her skin color is good. There is no paleness or bruising. And then here I'm just going to be looking at her umbilical cord and her genitalia. Her cord is dry. It is healing very nicely. There's no bleeding, no drainage, no pus or anything around that. And then her genitalia is a little swollen, but that's to be expected. There's some slight red drainage, which is also normal for a female baby, so we can just wipe that away. It just comes from your hormones as her mom. And if this were a male baby, then we would be looking at the testes to see that they were descended down into the scrotum and not stuck in the inguinal canal. And then looking at her hips, they are midline and even with each other. I'll just be assessing those here. Good. And then looking at her toes, she has all 10 toes, and she also has creases on the bottom of her feet as well. And doing the Babinski reflex here, just making sure that her toes fan out as I do this, which they are, so that is good. I'm just going to cover her up here. And then what I'm going to be assessing here is called the moral reflex. I'm just going to pick her hands up and drop them like this and startle her. So that is what we are looking for. And then looking on the back here at the spine, just making sure it is midline. There are no tufts of hair at the base of the spinal cord, which they are not. That if there were, that would indicate possible spina bifida. And her behavior was good. She toughed it out, even though I know she probably didn't want to. So we are all done. Thank you.